Mental health literacy is an essential tool for every DEI leader and advocate's toolbox. By incorporating it into your DEI initiatives, you can make a real difference in the mental wellness of your organization while also improving performance and accelerating your DEI priorities. Before the pandemic, it was trendy for companies in America to discuss mental health and workplace well-being and how they might create more psychological safety in their organizational culture to improve performance. Now, we all recognize that as mission critical. We all now know that mental well-being is not only essential for employee engagement and happiness, but it's also a leading driver of productivity, performance, and retention. But did you also know that a large subset of your colleagues are struggling a ton more than others? LGBTQ+ adults are twice as likely to experience mental illness. And Black Americans are 28% less likely to seek help than white Americans. Hi, I'm Adam Niemer. I spent 20 years as a CFO and senior operations executive at one of the largest healthcare organizations in America, all the while unknowingly struggling daily with undiagnosed depression and anxiety. When I was 29, I found my dad after he died of suicide, and I didn't get enough help that I needed. And over the years, as my executive career grew, so did my mental illness. Then one day, my boss, using tools he just learned from a simple mental health literacy class, noticed I was struggling and encouraged me to seek some help. 9 years later, I'm happy, healthy, and living my calling. Educating DEI and other corporate leaders on the critical importance of putting mental health literacy in your leadership toolboxes, right next to marketing, sales, change management, financial planning, and all the other skills and talents you've acquired over the years. Educating leaders that mental illness is real, that it hurts as much as physical illness, how to recognize if a colleague may be struggling, and how to help them get help. And right now, DEI leaders are some of the most challenged in America. For the most part, while 90% of Fortune 500 companies have DEI programs, their leaders face such strong headwinds. Y'all are woefully underfunded, usually not staffed anywhere near where you need to be, struggling to compete with other corporate revenue-generating investments. And with all of those headwinds, y'all are challenged with rewiring how company leaders think and behave so that they're inclusive, equitable, and creating psychological safe work environments for everyone that recruit, retain, and promote high quality of talent from diverse backgrounds. In this environment, spreading mental health literacy through your organizations is a simple and cost-effective measure to take that will help accelerate all of your DEI goals. There's no debate today of the correlation between our colleagues' mental well-being and their retention, engagement, and work performance. And there's no debate today around the alarming state of mental health in America post-pandemic. Did you know that the U.S. Surgeon General recently called out workplace well-being as one of the top 5 population health risks in the United States? Not homelessness, addiction, or diabetes, but workplace well-being, how we experience our leaders and how we experience each other in our workplaces is one of the top 5 population health risks in the United States. It's also one of America's greatest business risks. Driven by our next generation, 81% of workers report that they'll be looking for workplaces that support mental health in the future. You know, what's often lost is the fact that mental health impacts organizational performance just as much as physical health. Just like a physical illness, when employees experience mental illness, it impacts attendance, productivity, performance, and team dynamics. Workers struggling with a mental health condition are 27% less productive, have higher absenteeism and turnover, and 20% struggle with their emotions and get caught in fight or flight spirals. And there's no debate today that mental illness is felt disproportionately by traditionally underrepresented groups. According to the National Alliance on Mental Illness, while 20% of all Americans experience a clinically diagnosable mental illness each year, mental illness is far more prevalent among employees from diverse backgrounds. I've already shared a few stats with you earlier. Here are a few more. Women in America experience depression at twice the rate of men. Multiracial Americans have a 75% higher prevalence rate of mental illness than white Americans. Veterans are 15 times more likely to experience PTSD than civilians. And while neither disadvantaged in any way nor a population from a diverse background, white men in America die by suicide at 4 times the rate of women and account for 70% of annual suicide deaths. Here are 4 simple things that DEI leaders can start doing immediately to make a difference. First, choose to become mental health literate. Learn to notice the signs that someone might be struggling and learn the words to use to encourage them to get help by taking a mental health literacy class. Connect with us at Simple Mental Health and we can help you arrange that training. Second, hold mental health literacy workshops for your organization's senior leadership team. Third, cascade that same mental health literacy training to all your business resource groups, your employee resource group leaders, participants, and advocates. Fourth, if you don't have one already, launch a mental well-being BRG or ERG in your company. Look, becoming mental health literate doesn't make you a therapist, just like learning first aid doesn't make you a physician. It simply equips you with the tools you need to identify when someone needs help and how to encourage them how to get it. Mental health literacy is an essential tool for every DEI leader and advocate's toolbox. By incorporating it in your DEI initiatives, you can make a real difference in the mental wellness of your organization while also improving performance and accelerating your DEI priorities. It's really simple to take the first step and start today. Connect with us at Simple Mental Health if you'd like to learn more. And as always, please leave comments and let us know what you think. And if you found the message helpful and valuable, please share the link with your community. The more y'all share these videos, the more we can put out there.